Welcome to the AACS Daily News. It's still flu season, and Attleboro Public Health Nurse Jacquie O'Brien says that there's been an uptick in cases across the country. In addition, there's been a new concern about the rise of the coronavirus. We spoke with her to learn more.
Hi, I'm Jacquie O'Brien, the public health nurse for the city of Attleboro. So we're in the 2019-2020 flu season, and in December of 2019, there was a new coronavirus that was identified, now called coronavirus ID-19. And so we've had an unusual flu season. We actually started off a little bit early with influenza B, which we don't typically see until around February, until late flu season, but we actually started getting cases early this year. We had the first wave of flu. Then we're starting up again the last several weeks with flu, and we're seeing actually a higher number of cases of flu this year in the United States. It's still kind of up there right now. It's still a good time for people to get their flu vaccine. It's never too late. And so there's been a lot of talk about coronavirus ID-19 since December, and it's an ever-evolving situation. We're getting information daily. There's nobody quite here that's an expert on it. Dr. Quinn, Alan Perry, and I were closely monitoring the situation, and we're working with the State Department of Public Health. There have been ongoing conference calls about the situation. Luckily, we are relatively at low risk in Massachusetts right now. We have had one confirmed case, and as of this morning, there are 13 positive cases in the United States. But again, this is a situation that could be ever evolving. There are people that are in quarantine right now that have come back from mainland China or from other places overseas that are being quarantined for 14 days as preventive and precautionary measures. Really, they're no different than what we recommend from every single year, even when we think about influenza. So, first of all, we encourage people to have a healthy lifestyle. We want to make sure that they're getting a good diet, that they're getting sufficient sleep, that they're up to date on all their immunizations. If you are sick, please stay home. We understand that it's difficult many times for economic reasons, but if people can stay home when they're sick, self-isolating, that helps stop spread of disease, whether it be colds or flu or gastrointestinal illnesses, to other people. Number one, of course, is good hand washing, making sure that you're doing the minimum of 20 seconds with warm water and soap if it's available. If not, using a alcohol-based hand sanitizer. If you do have to cough, making sure that you're either coughing into the corner of your elbow or into a tissue, and then again, going to wash your hands after something like that. Right now, in the United States, general use of mask is not recommended. Again, the precautions and the preventive measures that I just mentioned are really the best things that people can do to help protect themselves and others. Doesn't mean that people are going to stop using those measures, but again, that is not generally what is recommended at the moment. Because it is ever evolving, we're always learning new things. There are 3 websites that people can go to. So people can go to the World Health Organization website, which is www.who.int, and look for the coronavirus ID-19. They could also go to the Mass Department of Public Health website. If you go under mass.gov and look up coronavirus, it will bring you to the homepage for coronavirus. And the State Department of Public Health actually has, I believe, 6 or 7 different public health fact sheets in English, Chinese, and at least 4 or 5 other languages for people to be able to refer. And then, of course, the Centers for Disease Control website, and that's www.cdc.gov. And again, if you put in coronavirus, if it's not even on the homepage at this point, it'll bring you to the most current and relevant information. And certainly if people have any questions, again, we are not experts. If you do have any questions, we welcome you to call the health department at 508-223-2222. My extension is 3244, and I can do my best to try to answer your questions.
That's it for today's update. You can watch all of our content by visiting our website, AACS.com, by downloading the AACS mobile app, or if you have a Roku, you can search for the AACS Roku channel. For AACS News, I'm Austin Ricketts.